welcome to our special show, Health and Wellness, Myths and Facts. The primary difference between health and wellness is that health is the goal and wellness is the active process of achieving it. Now, you truly cannot have health without first achieving wellness, and 2 years into the pandemic, our lives have become more sedentary than before. Long working hours, sedentary lifestyles, poor food choices and lack of physical activity are all factors that contribute to a variety of lifestyle disorders. People with pre-existing disorders like diabetes and heart disease have been affected the most in the pandemics. Now, medication adherence must become a priority as we deal with the continuing effects of the pandemic. It can affect both the quality and length of life and overall healthcare costs. It's important that individuals continue to take their medications as prescribed by their doctors to keep their conditions under control. And for some people, medical adherence itself is a new term to discover. For some, there are many misconceptions about it. Well, we have an expert panel with us today to clarify all your doubts regarding medical adherence. Joining us, Dr. Parikshit Goswami, consultant diabetologist and endocrine physician, Ayush Diabetes Clinic, Himmatnagar. We also have Dr. Harikrishnan, P, senior consultant interventional cardiologist, Apollo Hospitals at Chennai. Thank you so much, doctors, for taking time out and joining us on this program today. Dr. Parikshit, I'd like to start with you. Many people are unaware of the importance of medication adherence. Could you just explain what medical adherence is, why it's critical for people with chronic illnesses such as diabetes and heart disease to take their medications on time?
Yeah, good afternoon, viewers. It is very important to take your medication regularly. In layman terms, if I would like to define a medical adherence, it is just you need to take your medication regularly, which is prescribed by your physician or your doctor. Why it is important to take your medication regularly? As our anchor mentioned, the medical adherence is a new term for many of you. Because if a person who is suffering from chronic illnesses like diabetes and hypertension, generally they carry a lot of complication risk along with it. So to lower down this complication risk, you need to control your blood sugar level and blood pressure very well. And medical adherence, medication adherence is the key to overcome this situation. If any person or patient suffering from diabetes or hypertension, if he or she not follow, then they will have a lot of bad consequences. First, they will have to visit hospitals very often for medical emergencies. And at the same time, this major risk, diseases like diabetes and hypertension carries the risk for heart disease, kidney disease, and the severe stroke.
All right, Dr. Harikrishnan, if you could just elaborate further on that. Smart approaches provide a solution. Could you please tell us how self-monitoring devices help in improving medication adherence?
Hi, Gargi, and hi, viewers. The smart monitoring devices are very important. I think what we have to do is we have to make sure that the medications are taken properly, and by doing that we are actually improving the outcomes of the patients. So when you look at these smart devices, for example, you have continuous glucose monitoring devices which are available in India. So for example, if a person is asked to check the sugars regularly by means of pricking up the fingers, they tend not to do it because they are often painful and they are afraid of repeatedly pricking. So the continuous glucose monitoring devices circumvent this problem by allowing people to just by applying a monitor just behind their arm, and they monitor the sugars regularly, and the person doesn't need to really prick their arm. They can easily just monitor their sugars and accordingly tighten their medications. Again, for blood pressures, I think home blood pressure monitoring plays a vital role. For example, a person coming to the clinic often have a white coat effect of the blood pressure. They're often worried. Then when the people have a very good home blood pressure monitoring, we often insist these monitors are often calibrated regularly. They have to bring it to a clinic and try to calibrate it. And by doing that, they tend to have the normal blood pressure at home, which I think would be in the range what they expect. And if that's the case, then they don't need to worry about it. So by these means, it could be smartly monitored.
All right, and Dr. Parikshit, if you could tell us more about this proper method for measuring and monitoring blood sugar and blood pressure levels at home itself.
Yeah, this is very critical actually. Why it is so? Because the monitoring is the key to control the blood sugar level and the blood pressure, both. And as my colleague mentioned, now with the smart devices, you can measure the blood sugar level without breaking. But at the same time, still we have to rely on a glucometer most often and the blood pressure monitoring at home. First, I will give the steps or the important points which you should take care while measuring the blood sugar level.
Sure.
First important point is that you should wash your hand before doing your blood sugar checking, because any food particle, if it is there on your hands, then it gives a false reading. The second important point, which is most important, is that you should prick your fingertips actually with the same lancet actually, okay, which is provided along with your blood glucose monitor. The third point is that each and every glucometer company have a separate glucometer strip. So you should use the same glucometer strip which is given for your glucometer. You cannot interchange it. And last and most important aspect to remember for all of you is that please record that blood sugar level in your chart, because then your healthcare provider, your physician, your doctors can make the necessary changes in your medication. Now the second important part is the blood pressure monitoring. Again, as my colleague mentioned, that it is very important to nullify the white coat hypertension, which we often see in our clinic. So what you should do while measuring the blood pressure at home? The first and foremost thing, sit in a calm manner, actually relaxed manner. You should not be any stressful condition like phone calls, heavy meals, or any other stressful situation. You should place your left or right hand at the parallel level of your heart or your chest level. And the important point to note here is that you should not tie the blood pressure cuff too tightly or too loosely. That's the key, otherwise it gives a false result. And last and most important, measure your blood pressure level at the same day, preferably. Of course, there are diurnal variation, that there are a morning blood pressure maybe a little higher, evening maybe lower, and there are inter-individual variation also. But for a home monitoring, please measure your blood pressure level at the same day, same time.
All right, so many factors to be kept in mind when monitoring at home. Dr. Harikrishnan, after a few weeks of heart surgery, some patients begin to live a regular life. They even are walking normally. In such a situation, do patients still need to consult their doctor regularly, and can they stop taking their medication on their own?
So this is one factor which we should be, telling patients that even though the heart surgeries like angioplasty and bypass surgery are being done, then the base is still medications and lifestyle changes along with the medications. So they can't stop medications. For example, we have to, continuously monitor their cardiovascular risk profile, because these patients will be at a higher risk for future events like heart attacks, strokes, and other complications because of, the cardiovascular risk they possess actually. So I think these patients should continue taking their medications in spite of having very good profile. Some of the values for example, LDL cholesterol of 130 would be normal for other people, but LDL of only 50 is desired for people with a heart attack. The guidelines are very strict So without medications, lifestyle alone will not be helpful in these patients. Again, blood pressure should be, if possible, below 130/80 in most of the people with heart disease and strokes. So I think people should be aware of the fact that medications are essential. Anything done like an angioplasty or a bypass is on top of that actually. So along with lifestyle changes, these factors should be kept in mind. And medications can't be stopped unless the physician finds a side effect of a medication or a physician needs to change it, then it's okay.
All right. Thank you so much for that, Doctor. You're watching Health and Wellness, Myths versus Facts. We'll slip into a short break and return with more. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about medical adherence today. Let's go across to the doctors, and let's start with Dr. Parikshit. What is the importance of HbA1c tests for people with diabetes? How often should they get it done? Do these tests help people with diabetes lower their medication dose on their own? And when should a person with diabetes ask his doctor for a change of medication?
Yeah, this is a very important question for all of you actually. HbA1c is a key parameter which we often tell our patient to do, because it not only measures your blood sugar level for past 3 months, average blood sugar level for your past 3 months, but at the same time you can predict the complication risk associated with a diabetes. So if your HbA1c is higher, that is above 8 or 9%, then you are carrying a much higher risk for a complication like heart disease, kidney disease, CV stroke, your nerve disease. So it is necessary to measure the HbA1c level at every 3-month interval. There are other tests which you should often measure. That is a lipid profile, your kidney function test, your liver function test. Now, regarding the lowering down the medications or taking a less number of pills, which often every individual or every diabetes patient wants to do. But if you follow a regular lifestyle, that is, you adhere to diet, exercise, and of course, which I mentioned regarding the good monitoring, then your blood sugar level is going to down, or in other terms, I would like to say, you are going to control your blood sugar level very well. And at one point of the time, doctor himself or herself will lower down the medications. It is very risky, or it is harmful to do it your own actually. You should not do that. Let your doctors do that. Thank you.
All right, important, to always consult the doctor before taking any steps regarding your medication. Dr. Harikrishnan, some people with diabetes and heart disease believe if they forget to take their morning medicine, then they combine it with their morning and afternoon doses and take both at the same time. So if you could tell us a bit about that, does it have a negative effect on sugar levels or cholesterol levels?
So the medication should be taken at the same time, if possible, every time, every day at the same time. For example, if we are advising statins at night time, there is a reason for that, because most of the cholesterol production occurs at night and you have to tailor the medications accordingly. Some people have blood pressure, which is a nocturnal blood pressure. Some medications work better at night, some medications work better in the morning. So if you have people who tend to miss occasionally, very occasionally, it's not a problem. But most of the time, I think better to stick on to the same time of the day when we are advised, the patients are advised to take the medications. And the other point is, some of them are long-acting medications. For example, statins sometimes could be, if missed at night time, if there's not convenient at night time, could be taken in the morning also. So you have to try to consult your doctor before switching and changing medications. For example, if you change your medications and combine them there is risk of hypoglycemia with diabetic medication. So that should not be done unless you consult your doctor, and you have to make sure it's okay to do that. So better to stick on to the same timing and make sure you are compliant with the medications. Even large trials, which controlled trials, have shown that the adherence of medications is the worst problem in the world. People only take medications around 50 to 60% of the time with the dosage which is being prescribed or with the timing it's been done. So that's a major issue.
All right, I didn't realize it was such a huge problem. Clearly, if you're saying those are the statistics, and speaking about, not clubbing your doses of medicine, Dr. Parikshit, if you could tell us, hypoglycemic episodes can occur in people with diabetes, and to overcome this and avoid a hyperglycemic condition, how much sugar or carbohydrates should they consume?
Yeah. So this is a big myth actually in the society. To overcome the hypoglycemia, you take the sugar actually. So first and foremost, a diabetes patient or individual per se are at increased risk of hypoglycemia. So first, how one can prevent these hypoglycemic episodes in their life. So first and foremost thing again here is monitoring. The blood sugar monitoring is the key, number one. And there are certain diabetes patients or certain diabetes patient population are at increased risk of hypoglycemia. So like elderly patient populations, patients who are taking insulin, patients who are taking multiple anti-diabetic drug, as my doctor colleague said, that you will have an increased risk of hypoglycemia if you combine them. Those patients who are suffering from kidney disease, liver disease, and other comorbid medical conditions, they are at increased risk of hypoglycemia. So monitoring is the key to prevent. That's the number one. And at the same time, you should, if you are feeling hypoglycemic, you should check the blood sugar level. If it is less than 70 milligram per deciliter, then 15 gram of sugar or carbohydrate you should take in the form of juice or sugary candy, and there are separate medical tablets are available to mitigate the risk of hypoglycemia.
All right, Dr. Harikrishnan, medication for hypertension often makes people feel a lot better. What is the normal and concerning blood pressure range, particularly for Indians? And do people with hypertension who have normal blood pressure still need to take medicine on a daily basis?
So again, I don't think there anything specific, especially for Indians. Our guidelines are quite relaxed. 140/90 is the cutoff values. And if you look at the values comparing European and American values, I think Americans are a little bit more stricter. 130/80 they would advise. But in India, I think we would better to stick on to 140/90. People who have high risk factors, already had a heart attack, stroke, or diabetic people on insulin should try to even have a lower blood pressure if possible. And people who are taking medications should adhere to medications. Lifestyle alone is not enough, because there's a pleiotropic effect of blood pressure medications, including overall improving the cardiovascular risk and preventing a heart attack, preventing a stroke, decreasing the progression of kidney disease, preventing retinopathy. All these things are added benefits of medications. So once they feel better, doesn't mean they have to should stop medications. They have to make sure they are consulting their doctor. If it's not necessary, the doctor would do it under guidance is better. But the cutoff values of 140/90 is an average. You don't need to worry about little variations. Often people get too much worried. I think an average of less than 140/90 would do for Indians.
All right. Thank you so much, Dr. Harikrishnan and Dr. Parikshit. Thank you so much for joining us on this program and talking about the importance of medical adherence. Thank you for watching. Goodbye.